The global burden of disease seems to be moving from communicable to non-communicable diseases. Kidney disease is one of the non-communicable diseases whose global occurrence is currently increasing. A human being has two kidneys which play a very important role as the body's main filter of poisonous waste. The kidney filters out toxins from the blood, eliminates the toxins through urine, and releases the clean blood back into the body for use. Kidney disease occurs when a kidney fails to function normally. Acute kidney injury and chronic kidney disease are two forms of kidney disease. Acute kidney injury is when the kidney suddenly stops functioning normally. However, chronic kidney disease occurs when the kidney slowly loses its ability to function normally. Health conditions like diabetes, obesity, high blood pressure, and infections can affect the kidney's ability to function normally. These conditions can lead to a disease called chronic kidney disease. Some of the signs and symptoms of chronic kidney disease include changes in urination, trouble sleeping and concentrating, and loss of appetite. A person with chronic kidney disease can also present with itchy skin, swollen feet, swollen ankles, persistent fatigue, and general body weakness. Chronic kidney disease can be treated with kidney transplant, a procedure where a patient receives a functioning kidney from another person. Kidney transplant services are not available in Malawi. The services are accessible in countries outside Malawi, making them unaffordable for most Malawians. The alternative management to kidney transplant is dialysis. During dialysis, a machine is used to function as a kidney and eliminate waste from the human body. Dialysis is the only readily available option in Malawi, with 17 dialysis machines serving a total of over 70 patients. Currently, dialysis is offered for free in two government hospitals, Kamu Central Hospital and Queen Elizabeth Central Hospital. Kamu Central Hospital is one of the two main public hospitals offering dialysis treatment for free to the Malawian population. It serves a population from the 9 districts in the Central Region and the 6 districts in the Northern Region. We interviewed people living with chronic kidney disease to learn about their experience with the condition.
Dzina langa ndine Angela Watson, ndimachokera ku Mzimba ku Yautini. Koma pakali pano ndimakhala chakukaliyeka uko. It was in 2015. Ndinali ku South Africa ndimagwira ntchito mutwini. Kuntchito ndimapita ndithu mwabwinobwino mosadziwa kuti ndiodwala. Koma tsiku lina lakelo ndinamva kumva kuti ineyo munthu ine mphamvu zanga zotani zochepa. That day I failed to work for 45 minutes. Instead I did that work for almost 2 hours. Because I was like, ndiyalako chimodzi ndikhala basa until I finished in 2 hours. Then pamene naona kuti munthu ine I think I have to go to hospital. Ndinazasanzika amayi awo abwananga kuti munthu ine sindikumva bwino. Abwana palibe koma ndithamangebe ndipite pakachipatala kapafupi kuti akatani akandione. When I got there, kundiyeza BP, sister shook her head.
Angela was diagnosed with chronic kidney disease while she was living in South Africa. She started experiencing exhaustion and general body weakness for a day, which made her visit the hospital. At the hospital, she was told she had high blood pressure, a condition she never had before. Similar to Angela's story, Patrick started experiencing general body weakness for a few days. Later on, Patrick started having headaches, which persisted over a long period of time. Patrick did not realize that his urine production was reducing until they told him he was being suspected of having kidney disease. The doctors also found his blood pressure to be high, a condition he never had before.
Okay. My name is Patrick Munkondia. I am 52 years old and I stay in Biwi. Yes. Yes, I was diagnosed with kidney failure in 2022 in September, October, thereabout. Yes. What happened was that I started feeling very weak, and with that, I ended up having making a decision to simply stop working so as to preserve my integrity. Now, with the resignation, the headache started coming in again. So I had a prolonged headache for some time. And then
Initially, kidney disease was perceived to affect old people who were prone to health conditions like hypertension. Contrary to this perception, chronic kidney disease might affect children irrespective of their age. This can contribute to late diagnosis of the condition in children and late initiation of treatment. Kenneth Kunga is a 14-year-old living with chronic kidney disease. Kenneth's journey to experiencing symptoms to being diagnosed with kidney failure was different from the other two participants.
Dzina langa ndine Kenneth Kunga, ndimakhala ku area 3, ndi zaka 13. Ine kudwala nayamba mu 2021 mu December. Nangoona kuti mimba pasi pachoka ungondipweteka, kumangondipweteka ndayamba kusanza, kumangojeya kudya umangosanza. Tinapita pachipatala china cha private. Mwina kuja anakandiyeza malungo, komano malungo sanandipeze nawo. Ndi amangondibabe mankhwala malungo. Titabwera kuti tapita ku nyumba naona kuti kulere sindikupita, sindikukodza. Kumuona kuti ndingofoka bya kudya ndikadya, kumangosanza. Titakhalapo after 2 weeks tinapita kuchipatala china.
According to Kenneth, he started experiencing abdominal pains and vomiting. He was taken to a private clinic where they did a malaria test, which came out negative. However, the clinic gave him anti-malarial drugs, which did not improve his condition. Kenneth started experiencing weakness as the vomiting persisted for 2 weeks.
Tinapita kuchipatala china. Chimene chili chabome. Nde chipatala chimene chanandiyeza so kumandifunsa kubanika ndendoteya ndikubanika. Nde arandiyezeza naona kuti angonditumiza ku St. Kanakwananditumiza ku St. Hospital.
When Kenneth's parents noted no improvement, they visited another private hospital. This second clinic also treated Kenneth for malaria. After a few days of no improvement, Kenneth went to a government hospital which referred him to Kamu Central Hospital for further management.
Titabwera kuno tinafikira uje kumene amapanga munthu cheka kumamucheke zanthu kumati. Atandiona ananditenga sample anakayeza anaonoteso magazi ndochepa. Ndikaoneka mimba wananota zinthu zambiri zikuonongeka. Anandipanga admit 25 February. Ndinakhani malandira mankhwala amagazi. Nde tinachoka kodina tinapita sokodina. Kumene uja atakangofikira kundiyeza bibi anaona kuti bibi yakwera kwambiri. Ananditumiza ku HD. Ku HD kumene uja tinakhala timalandira mankhwala bibi. Kena kuno kunazabwera no dokotala anandiyeza mtima ndiyana kuti anena kuti mtimawo pali mudzi ndotupa. Then malandira mankhwala olandira kena kwanazabweranso zandiyeza ati Dr. arandiyeza amandiyeza msemphe ya magazi. Anaona kuti ati msemphe umodzi mbali yakuti ndonina ndamafuna kuti muna akautanule.
The journey to diagnosing kidney disease differs from patient to patient. It depends on the symptoms presented by the patient and the ability of the healthcare worker to relate the signs and symptoms to kidney disease. The level of the health facility Whether it's a small clinic or a big hospital also determines if the patient is diagnosed early or not. According to Kenneth, after he was referred to Kamu Central Hospital, the doctors did not first suspect kidney failure as a source of his problems. He remembers doctors treating and managing him for other conditions related to the heart and abdomen before suspecting that his kidneys might have failed.
Anazora kandi andiyezisoka chikenda ataizano mpomeno anona kuti misemba ari kuenda bwino yose chibwino bwino komano makidini ndamene akuoneka kuti impsyo zapwetekeka komano mwapompano chapompano koma chimene chapangitsa kuti impsyo ipwetekeke sikudziwika.
So I had a prolonged headache for some time, and then I came to the hospital because it became a bit worse, and immediately after like a month or two, that's when I was told that they suspected me to have kidney failure, and out of ignorance my urine experience was decreasing, but I did not know. That is when now the kidney failure came as a proposition that, as a suspect to say there was a kidney failure in the process. They got my blood test, yes, and they had to measure the kidney, the BP stuff, and those symptoms, were kind of indicators that the kidney was not functioning okay, yes. And so they had to put me on a machine. Luckily, it was earlier, and I never took long. Yes.
Angela's condition worsened and she was taken to the hospital again. This time, Angela learned that she had high salt levels in her body and she had developed kidney failure.
When I reached kunyumba kwa bwananga, ndangofika pa gate, I collapsed. Lakila nandona ndiana koza nada atabwera ku school. Ndiana tamanga. Granny, Angela has fallen down outside. Akokwaja, she came. Ndinzanga mendingakwena naye ntchito. In the morning mwana natsuka mama awo ndipsesera masi kundisambisa asisiteni kuchipatala tikamvoti ndichani. When we got there as foreigners, but so we were illegal. It was tough. What happened, I had to wait. I tell you, kuchipatala nafika kochama past 6, but until this time, ndisanaona nendiwe aliyesi. Doctor kumene kokwanauza kuti mutani ni muntenge masample nsema hii. Anantenga magazi. Ene koma lero lati peza HIV. Did but you won't imagine, it was negative and it was another story. Ndikukuamva kuyankhula manesi zaja kuti this lady masalt akhe ndipo ndokwela. By that time sendikazwa kuti mathubu mtili ndi michero yosiyana siyana ine sindimadziwa. Ndakangoyankhula nawo her salts, they are very high. Chan, the salts are thousands and thousands. She's very sick. Pamene paja ine number kudabwa kuti what is going on. Number kudabwa what is going on. Yankhulana when the doctors came. Kuna bwera ma doctors about 7. Atangondika pa waiting area. Ma doctors ajamba ukambirana okauka. It should be kidney failure. Chan. By then, ndikuti sindikuziwa so what is kidney failure or what. Then maganizo angaosa naloti ndiye kuti after this ndikakuti ndilishani ndiri bwino ndibwerera kunyumba muntu ndikagwiraso ntchito popo. Without knowing, winako wabwera anosopano usandilongosolera. Asisi matenda takupesane nawo, it's for the rest of your life. Akuti
Small clinics are more unlikely to diagnose kidney disease earlier than big hospitals. This does not only affect the diagnosis of the disease, but also affect how early the patient receives treatment. However, within a large hospital like Kamo Central Hospital, initiation of treatment like dialysis can depend on the availability of the machines and how fast the doctors will confirm your diagnosis.
Zinotenga nthawi yayitali ndithu, zinotenga of course mwezi kuti azindike zoti ndili nthenda yayo pete. It took me a month. And I was very sick and very weak.
About two months, yes, from October to November.
Kidney disease can catch a patient unawares. Most patients never realize that they have health conditions that might predispose or signify that they have chronic kidney disease. A patient might get to hear of this disease when they have it. For patients like Angela, she got to learn about kidney disease when they told her she had the disease. It took her medical providers 2 weeks to confirm she had chronic kidney disease, inform her of the diagnosis, and tell her that she will have chronic kidney disease for life.
Koma zinanditengera nthawi kuti ndivomereze kuti munthu ndikudwala. Then ndikuyikidwa choncho pa machine. Pana zapezeka kuti after a month, second month, anandiuza kuti muzikachokera ku nyumba. Ndinapita maulendo 8. Kusapezeka kuja undiuza kuti since you are a foreigner iweyo dialysis tikutani tokusiyisa. Ndagona first day. Second day, the same doctors amene ankandipanga treat, they came. Iwe ukadali pa usati nakuuza kuti iwe kunoku you don't qualify.
So they referred you to Malawi?
Yes, that's when they told me you are supposed to go to Malawi. So ndipita bwanje, I'm still looking for some monies. Ndipita. Ndikapeza ndirama. But what happened? How do I not giving you any treatment? I started crying. Ndinalira sisi ngati mwana wakhanda. I cried. The situation ndinalira. Chifukwa ndimadwala.
Angela was put on dialysis treatment. However, as an illegal foreign patient, Angela was discontinued from the dialysis machine and referred to her home country, Malawi. As discussed earlier, the treatment option for chronic kidney disease in Malawi is dialysis. This treatment has proven to be life-saving as described by the patients. Patients appreciate the improvement they experienced after attending the dialysis session.
Koma ine ndimayamika because these machines, ndingoti this is the best medication we get.
My life generally has been quite problematic, so to say, but the change has been very positive soon after I got onto the machine. Yes, and as I said earlier on, prior to that, I was feeling very weak with prolonged headache. However, soon after getting onto the machine, everything just changed like within the blink of an eye. So it was all fine with me. From my understanding, it appears like, these machines are multi-purpose. There are some of the diseases that it washes away without knowing while you are coming here for the kidney, and then it's also helping the other areas. So it could be very helpful to have these things, at least machine emoji on our way. Yes, we have got good people with monies in town here, honestly. Yeah, the government can do something. The only challenge is that being a breadwinner, so economically that has affected my daily life. So I'm minimized with my kind of work that I do. Usually instead of having a full throttle work, so I have to reschedule, and the fact that I have to come here on Wednesday and Saturday. So it means that from morning till about 12 o'clock or 1, I have to be on the machine. and then from 1 till about 2 or thereabout, I have to sleep, just to rest, to recover, yes. Then when I wake up, I'm just back onto my old self. And of late, the only change is that of late, even on the machine, I would work. Without resting, I would still work. So there are those changes that are coming in slowly. Maybe I'm getting better. Yes.
Since dialysis is offered in 2 central hospitals in Malawi, Kamu Central Hospital and Queen Elizabeth Central Hospital, the demand for the service is higher than the available resources. This affects the care patients receive. For example, patients are required to have dialysis 3 times a week. However, patients receive dialysis sessions twice per week to accommodate all patients who deserve to be on the machines.
When someone has got a kidney failure, she or he is supposed to come on the machine 3 times a week. But because of the shortages of the machines and the nurses, that's why we come twice. But it's not enough for us.
Yeah, ndimera khari kuendera kucho lachiindirayisana mpaka panopa ndimene makhari kuendera.
I come twice a week, on Wednesday and Saturday. Yes.
The centralization of the dialysis services forces patients to travel long distances or relocate to cities where the services are available.
The challenges are so many. We also need some other districts to have the renal units. For example,
some patients from the north and other districts travel or relocate to Lilongwe to get the services at Kamu Central Hospital. The same situation is also true for Queen Elizabeth Central Hospital.
Because like in muntu ndinowa kunzimba koma ndopezeka ko. So muntu sendikugwira ntchito ndifune nyumba ya rent, ndifune chakudya, ndifune ndirama ya mankhwala. Sizogwira. At least bweza kunzuzu kuti zikhala komweko. Akumwera zikhala komweko ndiyoti unit iri komweko. It will be very good.
Although dialysis services are offered for free, the need to visit the hospital frequently can be costly to the patient.
I would have loved if every health center has such units, established at every center, so much so that it can be easy for people to access the help.
Lack of resources, for example, adequate machines, accessories, and drugs also affect the delivery of dialysis sessions. Despite the government's effort to ensure the availability of resources, dialysis units can experience stockouts. This brings panic among patients and staff as the sessions are temporarily suspended awaiting the availability of resources. Patients also lament the unavailability of drugs like erythropoietin, a recommended drug for dialysis patients. Patients are required to get an injectable erythropoietin drug once a week to help their bodies produce blood. However, due to its scarcity in government hospitals, patients are asked to buy the drug from the pharmacy on their own. The drug costs about $30, which most patients cannot afford.
After this, timanika timwe mankhwala koma mankhwala kunoko kulibe. Chifukwa matenda ipso, imapweteka mafupa, nthawi zina loss of appetite, umanika ukhani mankhwala BP now and then every day. Ndiye kumapezeka kuti kuli mankhwala ena ake kuti azitonjezera magazi mthupi, because that is the big challenge. Chifukwa as I am talking now, ndinasiya kubaya erythropoietin, I think it's 2 months or 3 months back. Magazi anga anadrop. And akadropa choncho, muntu sumapeza mphamvu, you can't do anything. Before they used to give us, but now they tell us it's not there. So for a person to buy it, it's very expensive. Because one injection, it can reach up to 28,000 or more. So paliba mena kupanga afford. Ndandocheva kwambiri. And even dialysis, we are supposed to get it 3 times a week. but because of the challenges of the machines and the like, we can't, so we get it twice a week, but it's supposed to be 3 times.
This is Kenneth's mother. She describes machine breakdown and inadequate resources as some of the challenges she faces when caring for her son.
Kuno zovuta zimene tikumana nazo ndingalini kuti kumbali yomwe ya zipangizo mwina zikati kuti zatha zimatenga kumwina kanthawi kuti zifike ndi chimakhala zovuta ndithu kwa amene aliko ndi kandrama amatheka kukagula mwina malaizi, koma kwa amene tilibe ndi zimakhala zovuta ndithu. Komano akuyesesa ndithu kunoko madokta manesi mpakana zifute zitani mpaka session atani apange, koma chovuta kwambiri chimakhala chomwe kuti pena zipangizo zimakhala zochepa, pena machine amene ena akhale ngati kuti mwina avutirapo.
For Kenneth, being on dialysis treatment has affected his childhood dream of getting a good quality education. Like most patients getting dialysis, he experienced exhaustion and body weakness, which makes it tough for him to attend school.
School mbe yakhale yovulirabwe kuti sinangoti munthu kumene maphunzire nende kutali kuti ndiyende mtundu umene siningakwanitse ndimakhala befu ukumava munthu ubanika ukenda mtundu wautali.
According to Angela, patients with chronic kidney disease fall sick often, affecting productivity in their socio-economic lives. Both the disease and the dialysis treatment demand extra time from the patients. Loss of jobs is a common challenge among people living with chronic kidney disease. Patients are eventually forced into early retirement on medical grounds as a result of regular absenteeism.
It has affected me kwambiri because now I can't get a proper job. Palibe munthu angakulembe ntchito umuze kuti ne kawiri pa wiki ndimapita kuchipatala. It won't happen. And pa family, because this treatment is a long journey thing. Poyamba anthu amakhala nchikondi, but little by little they drop pang'ono pang'ono umapezeka kuti munthu uliweka. Munthu nali ndi azinzako, they all run away because they think uyu pang'ono atipempha drama sinangafuna apite kuchipatala. Those are the challenges because the transport is, so it's another challenge.
The only challenge is that being a breadwinner, so economically that has affected my daily life. So I'm minimized with my kind of work that I do. Usually instead of having a full throttle work, so I have to reschedule, and the fact that I have to come here on Wednesday and Saturday. So it means that from morning till about 12 o'clock or 1, I have to be on the machine. And then from 1 till about 2 or thereabout, I have to sleep.
Although the patients appreciate the government's effort to manage chronic kidney disease through dialysis and conservative management, the patients feel there is still more work to be done. Patients on dialysis experience some challenges related to dialysis care, as shown in this documentary.
Zovuta zimene ndimakumana zoni monga kukhala pa machine pa umapezeka kuti taludaso ma infection, umapezeka pa machine pa basi pena umasanza pena basi mungova mphepo basi.
If they can manage, can they extend these renal units? They say like in Lilongwe, there's more than 100 of patients ali kunja akuendeka kuti abwere pa machine, but they are not. It's because of the shortage of the machines. Ngati kungateke awonjezere renal unit and tikhale ndi special ward yoti anthu fe tikadwala tizikhala ndi ward yathu toka because matenda athu working with blood, you can see. Ndiye ndikapezeka kuti ndiri ku 4 ndiye kuti kuti chimpwirikiti ndiye kuti bedi kulibe ndauzidwa kuti ndikagone pakhonde. Whereas kuno kuti maphunziro kuti ndi nthenda yathu tikweneka tikhale pamalo poti pali smart, it's clean, it's always disinfected. Koma ku 4, is that done? No. Patupezeka kuti wadwala kutumizidwa kumeneko. Pochoka ukoko kamatuluka nditi matenda onjezerapo ino. Pamwamba pa kidney failure. You see, those are the challenges to the government. Mankhwala No one can afford kugula.
Patients worry that kidney-friendly diet is expensive. They suggest that government should assist them with easy access to kidney-friendly diet. Patients also suggest that government should ensure consistent provision of erythropoietin drugs and advocate with employers to minimize job loss among people living with chronic kidney disease.
Boma litiganizile.
Information should be led with the understanding that how does kidney patient feel like? You start from there. Yes, and then when it is developing, we should be also told to say this is how you should identify this problem on your own before even the medical people come in. By the time the medical people come in, they should simply come in with with a direct solution. Komano you makala kuti uyo wachiziwa kale iwe wachiyambapo kale. Yes.
Despite all the challenges faced, patients appreciate the effort of healthcare workers and government in the provision of dialysis care.
I think these guys are heavenly sent. Yes, because they don't take it as work per se, but they just come as something that they are called to do. They feel it themselves that they should do this and they are on it, which is very, very positive with an average of us. I hope I'm speaking the average mind. They are just mint. They're just so cool. I think these guys should not die. They're just very good.
Awareness on kidney disease, early diagnosis, early initiation on dialysis are some of the strategies needed to win the fight against kidney disease and yield good medical outcomes. There's a lot of investment needed in the fight against chronic kidney disease.